My name is Buford Moore. I'm an MD in private practice in plastic and reconstructive surgery. It's hard to know where to start with that. I tell people all the time I remember the ambulance ride downtown. I remember getting to my room, and I really don't remember anything else.
It was really scary. There was multiple times when I didn't think he'd actually make it.
My initial transfer from Houston Methodist was to the ICU at Kindred. And that was necessary because I was on a lot of medication and requiring very careful, very close care at that point.
He had one of those cases that was unfortunately one of the complicated cases of COVID.
He had every complication you can pretty much think of. Respiratory failure, he was on mechanical ventilation, he ended up having a blood clot.
Dr. Moore had acute inflammatory demyelinating polyneuropathy. It's where there was an inflammation caused by the virus that attacked his nerves.
He had to receive a tracheostomy tube, and when you're on the ventilator and you have a trach, you can't swallow, so he had a feeding tube in place. So he came to us really unable to walk, unable to stand, hardly even unable to tolerate being upright because his blood pressure would drop, which is a physiological response to being in bed for a long period of time. We really had to start from ground zero with Dr. Moore.
It took my breath away when I walked in, knowing I've worked with Dr. Moore for 15 years. So knowing the man that I had worked side by side with for some time and seeing what I saw in the ICU, it was astonishing. He was ventilator dependent. He needed to come to our facility. He needed to be at Kindred in the medical center because we could wean him off of that ventilator, and I knew that we could do it quickly. I also knew that we had the advantage of acute rehab in-house that we could capitalize on all of our days.
He received speech therapy where he slowly had his diet advanced to where he was able to start eating by mouth. He required less and less oxygen.
He was able to get off the ventilator, and that was, of course, a joyous occasion for everyone, especially himself.
As he progressed, he was able to have his trach capped and ultimately removed, and his swallowing function improved with strategies that we worked on in therapy.
Having that flow of care between units and physicians, I think that makes all the difference. That was one of the benefits to Kindred. That was one of the reasons we went to Kindred, because he could transition from one unit to the next and have that continuity of care with the staff.
So I was standing in his room one morning, and the physician walked in and said, "What do you do for a living?" And his response was, "I was a plastic surgeon." I stood there for a minute and I looked at him and I said, "No, you weren't past tense a plastic surgeon. You are a plastic surgeon." And that was how our early conversation started. What do we need to do to get you home? What do we need to do to get you back in an OR? We talked about suturing and the fine motor skills that you really need for nice suture lines. So we found some materials and brought them, and I just dumped all of this stuff on the table. I said, "Well, here you go. Let's see it." And he looked at me for a minute and he laughed, and then he picked up some hemostats and a needle and thread, and he started suturing, and he was suturing lines.
He was tying sutures, which made me so proud of him. And I could tell that he was like, okay, a future might be there for me to go back to practicing.
He was really determined to actually improve himself. So I gotta say, he was a fighter. He was probably one of my favorite patients in the whole entire area. And just to see the incremental gains that he got, and then what he stood for and what he wanted to accomplish. I mean, he had the whole hospital lined up on the end walls, and we all clapping. He's walking down.
Just knowing we were actually bringing him home and that he was able to walk into the house, to me, is nothing short of a miracle.
Oh, it's great to be home and be with your family, and I wouldn't be where I am today without those guys. I can't praise them too highly and thank them for all the things that they did.
4 months and 1 day after he got sick, to watch him walk down my hall and go home, it's things like that that tell you that you have an amazing group of individuals doing amazing work.
They provided me with a lot of tools to work on my hands and regain the sort of dexterity that I need to be a surgeon again. 2 months ago it seemed impossible. Now it doesn't seem impossible that that might happen. My name is Dr. Buford Moore. I'm a plastic surgeon and a COVID survivor, and I'm happy to be at home after a long and scary journey to survival.